I want to actually talk about frequency of suckling in breastfeeding. Frequency of suckling in breastfeeding. Okay, so this is like trying to look at the average times that a mother that just gave birth with no complications, okay, no medical proof that she shouldn't breastfeed her baby, how she should normally be breastfeeding her baby, the frequency. So in summary, you said that typically suckling is about 8 to 12 times in a 24-hour period, okay, during the first few weeks of life. Okay, during the first few weeks of life, they're not eating much, but they are eating more frequently. Okay, now the frequent feeding helps to establish milk supply and ensure that the baby is getting enough nutrition. So the first 2 to 4 weeks of life, they usually feed every 2 to 3 hours, just like what we said. So 8 to 12 times in a day. So after the first month, frequency decrease. Do you understand? But some babies might still be nursing 6 to 8 times in a day. So growth spurts. So during period of rapid growth, around 2 weeks, 6 weeks, third month, babies may nurse more frequently just to increase the milk supply that is sufficient for growth. So feeding cues to watch out for is, rather than relying strictly on the clock, you can't see. Babies are different, genetics are different. You can't rely on what we are teaching online. This is just for education's sake. If you are watching this and you are a mother, please follow what your baby is doing. Okay, you can't rely on this on the clock, right? So just anytime your baby is actually needing food, okay, baby is crying, hand to mouth movements, please just give them the food. Okay, don't come and say this doctor online said this is the time, right? So nighttime feedings, babies needs to feed throughout the night, especially in the early weeks. If your baby sleeps longer than 3 hours during the day or night, some healthcare providers recommend wake them to eat. Funny enough. Okay, so this frequent suckling matters because it stimulates milk production, it provides comfort and bonding between the mother and the baby, it ensures that the baby receives enough energy and enough water. Then on the mother side, it will prevent the mother from all those menstruation. It also prevents the mother from taking in if she's still actively having sex with her husband and all of that. So it serves as a form of natural contraception.